I've talked about kind of categorizing, is this hypovolemic or distributive? Is this cardiogenic? Is this obstructive? One of the main things that we're looking at is what is the LV function. That's one of the first things that we're trying to identify and evaluate. Now, after you've looked at a lot of these, just eyeballing it, you can get a good idea. Are the walls coming in together really well, or are they barely moving? But early on, or if you just want to be more specific with your measurement and evaluation, there's several measurements that you can use, going from really simple to much more advanced. I'll just show you a few of those here. So one of the easiest, I think, and really most rapidly performed is just looking at something called E-point septal separation. So as the heart fills, it kind of is dependent on how much of the blood was pumped out during systole as to how much is going to come back in to refill it. So the higher the ejection fraction, the more blood has to come back in to fill the heart. With more blood filling the heart, that mitral valve is going to open more rapidly and wider to allow for that increased entrance of blood. So what you're looking for with a normal ejection fraction is for that mitral valve during diastole to come up and almost hit the septal wall. And you can measure this. So putting M mode in a parasternal long axis view here through the septum and the mitral valve, you can look at this waveform. This is the movement of the mitral valve, and this is the septum. You can measure how close that mitral valve comes to the septum. A value less than 7 millimeters is normal, and as function decreases, that value gets greater and greater because less blood is flowing into the heart. An EPSS greater than 12 is equivalent to an EF of less than 35%. It's limited by some valvular problems like aortic insufficiency or mitral stenosis. So it's not perfect, but it's easy. And this is actually the way I do it. Rather than measuring it, I just use it as a second check to see, oh yeah, that mitral valve is getting close to the septum. That is pretty good ejection fraction.